So I wanted to ask about, so at this point in time, was it that you were saying that I want to work in public health, or was this something that you were just still trying to discover more about public health? Because you got into this program, you wrote an essay, you did all these things. So I imagine you had some kind of envisionment for like how this was going to impact your career, whichever direction. So tell us more about that.
For me, one of the things I realized is that I never worked in an office before, right? I worked at the bedside. I worked in the hospital setting to where we're constantly dealing with patients and all of those things. So being in a less, I wouldn't even call it stress, but I don't have the terminology, but just to say, you know, being in an office, you're not dealing with all of the complexities of being in a hospital. Or dealing with patients at the bedside. So I had to learn basic skills like how do you get on a meeting, right? How to deal with being quiet in your cubicle so that you don't bother the person next to you, right? Bringing headphones to work. You know, all of those simple things that you would think were so easy, I had to learn because I never experienced that before. So I would say I learned on the job, office etiquette, right? I also learned how to deal with conflict in the office, right? Like, how do you deal with something that you don't understand? Or how do you deal with new work, right? Because mind you, I told you I was new. So we were dealing with chicken pox. At the time, we had a measles outbreak. Oh, no, I'm sorry. It wasn't measles. It was mumps. We had a mumps outbreak. Mumps was starting to reemerge at a local college. So we were doing investigations and there were all of these things that I never experienced before. But the way that I am, I was just a sponge and I was just trying to learn as much as I could. And another thing that I always would suggest for folks that are in these programs is to take advantage of as many opportunities as you can while you're there. One of the things I did is in Louisiana at the PHAP program, not at the PHAP program, in Louisiana during the PHAP program, we were downtown in Louisiana. So actually what was pretty cool about our host site is, I want to say there was like 5 other PHAPs that were stationed there as well. So we had another one that was on another floor, like 2 or 3 floors before me. They were still working for the state of Louisiana. Then we had another PHAP that was working for the city of New Orleans. We had another one that was working for LSU and so on. So with that, we all got to go in each other's environments and we all got to volunteer. So somebody would come and help me with stuff. I would come and help them with stuff. And that's how I was able to diversify my resume, was getting that experience. But I also didn't do it just for the resume. I did it because I was truly intrigued and interested because like I told you, I didn't know anything about this public health stuff. So utilizing my time and maximizing my time during the PHAP program, I think is what was the biggest benefit to my public health career because I got to understand a little bit about emergency preparedness, right? In Louisiana, we had hurricanes, tornadoes, all of the things. So I got to understand what that was. So yeah, several things that I took from that program that has definitely shaped my public health career and has piqued my interest to continue to be in public health as I am now.
So yeah, that's amazing. I'm glad that PHAP gave you the opportunity as well as really allow you to expand your network. And I feel like being intentional in expanding your network while you were there with the other PHAP people, as well as you said, like building out even more experiences from gaining, from working with the other PHAP people on different projects that they're doing,